Hello, good evening. We'll take a few minutes to set up the stream across our social platforms. Great. Welcome to the live Q&A session with NYBG surgeon Dr. Sekhar and NYBG plastic surgeon Dr. Shafqat. Please add any questions you may have in your comments box, and we'll try to answer as many as we can. Let's start with an introduction from you, Dr. Sekhar.
Hi, I'm Nick Sekhar. I'm so happy that all of you joined our Q&A tonight. We're both very passionate about what we do, and I'm interested in learning a lot more from Dr. Shafqat. We had a lively dialogue and discussion a few months ago, so I'm interested in updating him on some new technologies that we are beginning to offer at New York Bariatric Group, and I want to learn the latest in investments or advancements in plastic surgery from Dr. Shafqat. So I look forward to engaging in that dialogue and learning more, and also fielding some questions from the audience. So I look forward to tonight.
Dr. Shafqat?
Yeah, and I'll echo that. I just want to thank everybody for joining us. Thank everybody for their time. Thank Dr. Sekhar for agreeing to do this with me. As he mentioned, we did this several months ago, and it was a great dialogue. I think everybody got a lot out of it, and I'm very excited to share plastic surgery with you all, but more excited to learn about some of the new things that Dr. Sekhar and his colleagues are doing on the bariatric side of our group. And so I'm looking forward to it. I'm looking forward to answering your questions, and yeah, it should be a great evening. So just to jump in, I'm going to ask Dr. Sekhar some questions, because there's a lot of new stuff going on here, and I've seen it all over social media. I've seen everybody talking about it. I want to know about endoscopic sleeve gastroplasty. Like I said, I've seen it all over Instagram, people talking about it. Seems super cool, but I want to know more about it. What is it? How does it work? How does it differ from the other weight loss procedures that you all are doing right now?
Yeah, and it's really an exciting advancement. And it is something that I've had, even though it's kind of the fresh and brand new thing that is popular now, I have experience with this going back to the early 2000s. So as a fellow, I was actually involved in developing some of the first endoscopic suturing devices. What we use now currently is called the Overstitch, or the ESG device, and it's manufactured by Apollo, which is now part of Boston Scientific. But as a fellow, I was involved in some of these early trials. And what's amazing is that this procedure, which I have experienced going back to early 2000s, and in practice over 10 years of doing the endoscopic revisions for gastric bypasses. But what's interesting is that this endoscopic suturing device can be used to give a patient an incisionless surgery. So instead of making cuts in the belly, we can go in through the mouth and use this endoscopic suturing device, which just basically is attached to a standard gastroscope or an endoscope, what many of you have already experienced in the form of an upper endoscopy. We can do an incisionless surgery where we reduce the stomach volume by about 80%. So in effect, we are replicating the configuration of a sleeve without incisions, just going in through the patient's mouth while they're asleep and making the stomach into a tube. Basically reducing the volume by about 80%, reducing hunger, and patients have really good results with this procedure. In the MERIT trial, which was a big trial that led to the FDA approval of this procedure, which was big news a few months ago, patients were seeing approximately 50% excess weight loss after the procedure, which is very equivalent to the laparoscopic sleeve gastrectomy. In my practice, we see between 60 to 70% excess weight loss. So you're getting about 80% of the weight loss of a sleeve gastrectomy without any incisions, with a very rapid recovery. So I did 2 of these procedures yesterday. I saw the patients this morning, they look better than I did. It was like I didn't even touch them yesterday. They were packed up, 9 o'clock in the morning, they were already ready to go home. And I couldn't believe it. It was, even though my results are great with the sleeve, patients after sleep will still have some discomfort the next morning. But these patients were basically no pain. They were dressed, packed, and ready to go. And we will be doing this procedure as an outpatient procedure. So you will come in to our surgery center. You will stay there for 3 hours. You'll get fluid. You'll get medicine for nausea. Although I haven't really seen much nausea with this procedure, interestingly. And you will be able to go home the same day. And by the next day or the day after, you'll feel back to normal. You'll just notice that your hunger is gone. And even if you drink some water, it's going to fill you up. So typically we keep patients on liquids for 2 weeks, then puree for 2 weeks, and then soft food for 2 weeks. But after that, you're on a regular diet, following a healthy diet and using it as a tool with exercise. And so I'm excited about the procedure, and I'm already seeing a lot of patients for it. And we look forward to offering it to our patients because it's a durable procedure. The sutures don't pull out. They tend to be a permanent solution for weight loss.
That's awesome. I mean, I remember learning how to do endoscopes in training, and I can't imagine doing it and trying to suture at the same time. So it just is a testament to y'all's skill level in doing these types of complex bariatric procedures. But, I always get curious, is there's so many procedures now, how does this fit in? What are the criteria for when you would offer somebody an ESG as opposed to another procedure?
A lot of it comes down to patient preference. So we know that fear factor related to surgery cuts down on a lot of patients who would benefit from a permanent procedure for weight loss. So this removes a lot of the fear factor of having a permanent change in your anatomy, because nothing that we do during an ESG is permanent. We can go back in with an endoscope and cut out the sutures in the future for whatever reason. But the surgery that we do is a permanent change to your anatomy. So that struck me as a reason. One important reason to offer this is because we only reach about 1% of the patients who qualify for the surgery. So this will expand the number of patients that we can help with this life-giving procedure, because the natural history of staying on diet treatment for weight loss is not good. Typically, most patients will regain the weight within 2 years. And then what unfortunately happens is that the side effects and ill effects of the usual suspects like diabetes and high blood pressure, they add up to early mortality and sickness for the patient. So now we have a safe procedure that offers many of the benefits of permanent surgery with an incisionless procedure that doesn't make any permanent change to the anatomy. You wake up, you feel like you've had a regular endoscopy, and you're back to your normal activity within 2 days. So it's a very safe option that will open up permanent weight loss to a large number of patients who would never have thought of surgery before. And similar requirements, if you have a BMI between 30 and 40, if you haven't been able to achieve weight loss with diet and exercise, or even for a slightly lower BMI between 27 to 30, if you have obesity-related health issues such as type 2 diabetes or high blood pressure, it's also a good option. So I'm excited about it because it's a really safe procedure in experienced hands. There's a lot of groups that are trying to capitalize on this interest in endoscopic procedures, GI groups who may have not had an interest in weight loss intervention are jumping on the bandwagon for this. But I would urge any patient to look into not just the experience with endoscopy, but the holistic approach to weight loss. So we have an infrastructure in our practice that's totally dedicated to weight loss. And the fact that we have a dedicated plastic surgeon, an expert in body contouring procedures, speaks to that depth of experience and breadth of experience in our practice, because we have the resources to devote to patients, and we offer everything from medical weight loss. I myself do medical weight loss, all the way up to endoscopic procedures, to advanced interventions and very difficult interventions for previous surgeries and revision procedures. So I would urge a patient who is considering a group for endoscopic sleeve gastrectomy to look into not just the endoscopy experience. I've done over 10,000 endoscopies. I've done over 3,000 surgeries, but also that ability to offer the comprehensive treatment, including weight loss dietitians, psychologists, weight loss specialists, including yourself. So we have the solutions to patients. Many patients will ask me, well, if I have extra skin after the procedure, what am I going to do? Well, I say, I'm going to get on the phone with Dr. Shafqat, who's been kind enough to even talk to my patients who have texted me about plastic surgery and talk directly to the patient. So, we have great resources. So we continue to offer the pinnacle of bariatric surgery care and weight loss care to our patients.
So it sounds awesome. I mean, it sounds like a great technology, great tool in your tool belt. As with all procedures, there's risks. So what are some of the risks that you can see with an ESG, in your hands?
So it's extremely low risk. The most common thing, which is not something that we have to go back in for or do any additional treatment, is that sometimes air can leak out of the stomach. The good news is that it's just carbon dioxide. So just like in a laparoscopy, it's quickly reabsorbed. So it's not like a conventional endoscopy where we use room air, which if that leaks out, that can cause a lot of pain. It'll take longer to reabsorb, but it will. But personally, I've done at least 500 of these endoscopic revision procedures, and I have not seen a major complication. It's been reported that occasionally, if the leak is large enough, it can cause an abscess or an infection, but that rarely needs to be treated with another procedure. And, with any procedure, there are risks. And a patient, I would urge a patient to have a full discussion about the risks and benefits of any procedure before committing to a procedure. And that would include the personal medical history of that patient coming in for that intervention. But all in all, it's a very safe alternative and should be considered for patients who had not considered a permanent intervention for weight loss in the past.
And I have one quick last question for you is recovery. Obviously, like you said, incisionless, not a ton of recovery compared to even, a conventional, laparoscopic sleeve. But what is the recovery process like? What do you tell your patients in terms of what to expect after, when can they get back to normal life, those types of things?
Yeah, it's a very quick recovery. It's very similar to recovery from a conventional endoscopy. So my patients, by the next day, they're back to normal. Within an hour or two after the procedure, they may have some bloating, they may feel distended, maybe some minor cramping, but within a few hours to a day or two after the procedure, you're going to feel back to normal. You're not going to be able to win any chugging contest at spring break anytime soon after the procedure, but as long as you're sipping a lot of water and your protein shakes, you're going to feel good. Within an hour or two after the procedure, within at least a day after the procedure, we want you walking around, getting those 10,000 steps a day. A common question is, can I get back into lifting, doing vigorous exercise? Yes, 100%. You can climb Mount Everest. You can explore Antarctica. You can do everything with this procedure. You're not going to pull out the sutures by physical activity.
Awesome. Well, thanks for all that information. I mean, it sounds like a really cool procedure. Can't wait to see some patients who have had it done, what their success is like. Yeah, I look forward to you all continuing to grow this branch of your armamentarium.
Yes, and it's a beautiful tool for weight loss. It is a great option for those patients who would not have considered weight loss procedure before. So I look forward to helping a lot more people. And you're going to be seeing a lot more people, because the more people we see, the more people who lose enough weight to potentially have extra skin. Because, just like a balloon, we take the air out. Sometimes patients are concerned by that extra skin. I always tell patients, well, you have extra skin because you lost a lot of weight and you're really healthy, but now I have a great guy for you to see who's going to help you with that. So a common question that I get from patients, because I see a lot of patients who've lost a lot of weight, when and why should one of my patients come and see you about a weight or about an intervention to get rid of the extra skin? And what types of plastic surgery procedures do you generally offer them?
Yeah, it's a great question. What I hear a lot from people is, people don't expect to come see a plastic surgeon after they've lost a lot of weight. Plastic surgery is very, the view of plastic surgery is very skewed in the mainstream media in terms of what plastic surgeons do. I mean, we do a huge breadth of, cosmetic, reconstructive, and everything in between. And so, patients on this weight loss journey, as you probably know, what you guys do is a tool, right? It's a tool to get them to their goals. But a lot of patients feel like they want to take it an extra step further. They feel like they've gotten really healthy. They've improved all their, medical issues, their diabetes, their high blood pressure. I hear that all the time. Like, oh, I used to have this. I used to have this. I used to have sleep apnea. It's all gone now. It's awesome. So, but people have a lot of this extra skin. Like you said, it's like a deflated balloon. People lose weight very rapidly. A lot of that skin quality is gone. And so they end up with a lot of this extra skin. And it really, really impacts their quality of life. I mean, I consider them partially reconstructive procedures. You're trying to improve patients' quality of life. It's not just, I want to look better. People get a lot of issues with this extra skin. It can impact their back. It can impact rashes, all types of stuff. So we specialize in these types of procedures after massive weight loss, whether it's non-surgical weight loss, whether it's diet and exercise, whether it's medical weight loss or surgery or whatever. We are we're trained basically to understand the body's anatomy, how the skin can collect in certain places, what is the best way to deal with that extra skin so that, number one, you minimize complications, and number two, you have a great outcome. And I always tell patients that patient safety and outcomes are the priorities, at least, for me and pretty much every other surgeon. So we do a lot of these. We're trained to do a lot of these. And we really understand the way to do these in the safest possible way. While they're similar to surgeries that you do in patients who've not had massive weight loss, they're also very different. And we can really tell the patients, what is the best surgery for you? How do we address your concerns in the best way? And that's basically what we're trained to do. We're trained to get people to their goals in the safest way possible. And that's why I think everybody should see a plastic surgeon after significant weight loss, because some people may have not considered it. Some people don't know what the options are out there. And so really the areas that we see most commonly that people are bothered by is, number one is the abdomen, definitely. It's probably number 1, 2, and 3, to be honest. I mean, people get a lot of that excess skin in the abdomen. And so there are a lot of different types of procedures that we do, from an abdominoplasty to a what we call a lower body lift, which is an abdominoplasty but goes all the way around the waist. There are procedures called fleur-de-lis abdominoplasties, which is a lower abdominal skin removal, but also up and down the midline. There's so many different types of ways to address what the patient's most concerned by. And we talk about all that and what their goals, what the people's anatomy are. The other areas we see are definitely chest in men and breasts in women. People lose a lot of that volume. They have a lot of ptosis or sagging of the breast, or even breast reductions. I mean, a lot of people who have a lot of dense breast tissue, they may not lose a lot of that breast volume when they lose the weight. Men develop excess skin in the chest, what we call gynecomastia. And then other areas that we see significantly are the arms. People do end up a lot of excess skin in the arms, the inner thighs, and then the face. Those are kind of the main target areas of the weight loss, or main target areas of the body after weight loss. So, I mean, we really tell the patients that we want to address your concerns, what they're really bothered by, and stage it in a way so that, again, people get the best outcomes and they're as safe as possible.
Yeah, thanks for that good summary. And I just want to give you some positive feedback because my patients love you. They enjoy seeing you because it's kind of like their victory lap when they come in and see you.
Definitely.
They've had a lot of success with weight loss. They see your smiling face, you listen to them. So we're really happy with the help that you've given to our patients. So I applaud you for that. But one other question that comes from a lot of patients is what makes them a good candidate for plastic surgery? What is your criteria? How much weight do they have to lose? When is it a good time? When is it a bad time?
Yeah, so that's great. Great question. And again, thank you for all the compliments. I hear nothing but compliments about you and all the other bariatric surgeons and everybody in the group. So it's wonderful to be a part of it. But while these procedures are in part ways reconstructive and medically necessary, they're also elective procedures. And elective procedures, basically what I tell people is we want to make sure that you're a good candidate. Again, safety and outcomes are paramount when you operate on people, no matter what you do. So I always look at, red flags for patients if they're not a good candidate and what makes them a good candidate. So from a weight loss standpoint, we definitely look at a couple things. So we want patients to be far enough out from their bariatric procedure so we know that they've lost the weight that they're going to lose and their weight has been stable. Typically, we say about a year from their bariatric surgery and about 3 months of stable weight because we don't want, nobody wants to have these surgeries and have fluctuating weight after. So that's pretty much that criteria. BMI is a topic that comes up a lot. It's a number that comes up a lot. I always talk to patients about BMI. It's not a perfect number, as we all know. Every patient with a BMI of 30 or 35 does not look the same. In general, we know by a lot of studies that as BMI goes up, risk of surgery goes up, especially for these body contouring procedures. So we want to make sure that patients are at a good BMI for them, and that can differ depending on the patient. I mean, typically we say less than 30, but sometimes patients may carry their weight in different areas. And so again, we tailor it for them. Sometimes patients with above a BMI of 30 may be a good candidate as well if they've lost, a significant amount of weight. So we really individualize it depending on the patient, their anatomy, how their fat is distributed, all that kind of stuff. And obviously we look at medical issues. If somebody has resolved all their medical issues and they're very healthy and they don't take any medications, then, they're a great candidate for surgery. Obviously we look at things that are going to impact wound healing, like diabetes. We look at, cardiac issues because they're long procedures. Just general health and overall status, if it makes them a good candidate for an elective procedure.
And most important question, does insurance cover any of these procedures?
Yeah, this is a topic I'm always learning about, I feel, because I feel like it always changes. So, insurance is an interesting game because, insurance companies are going to cover what they think are medically necessary. And I tell all patients, you can go on Google and you can Google your insurance plan blank whatever procedure you're interested in, and they'll tell you exactly what their criteria are. If you go on and you look up Aetna paniculectomy, they're going to tell you exactly what their criteria are. So, we always look at things as if they're medically necessary or not. Many insurance companies will look at these skin removal procedures as something that's medically necessary if the patient has the anatomy to demonstrate that, if they have chronic medical issues related to that, typically like back pain, rashes, things like that. Neck pain, back pain when it comes to larger breasts and patients looking for breast reduction. So every insurance company has different criteria. They have different criteria for how long you need to be from bariatric surgery, how long you need to have a stable weight, and what those criteria are. A lot of it is very dependent, on those factors. So a lot of the things that we add to these procedures to really make the aesthetic much better, liposuction, fat transfer, muscle tightening, those are by every insurance company considered cosmetic and not medically necessary. But they do add a lot to the ultimate result. And so we talk to patients about that. Are you looking for just insurance coverage? Are you looking for really maximal aesthetics? And again, we tailor it based on the patient and what their desired outcomes are. But I encourage all patients to, Google your insurance's criteria for these procedures, because some of them are, can be fairly strict. Some of them are a little bit more lenient, and you can see exactly what their criteria are for those different procedures and whether you think you're a candidate. And I always have, by doing this a lot and doing peer-to-peers and all that, I have a fairly good understanding of, when you come to see me based on your insurance company and your anatomy, I can tell you, do you have a reasonable shot of getting it approved or not? Sometimes that can change depending on the insurance company, but I think I can have a pretty fair discussion with people about what their chances are of getting some of these things approved. And again, what can we add on to that to make the aesthetic outcome significantly more better?
Yes. So the basic answer is come in and see you and you'll sort it out for them. They don't really have to worry about it.
Exactly.
Yeah. Or they could ask ChatGPT for the answer.
It will probably give them a better answer than me.
Yeah. One thing that it comes up frequently is it important to have a surgeon who's board certified? Can you talk more about that?
Yeah. That's a great question, because it does come up a lot, especially in plastic surgery. And it kind of piggybacks a little bit on what you said earlier is, you don't have to be a plastic surgeon per se to do these procedures. People who, really anybody can do it. You go to, some of these places and, really anybody, any type of surgeon can do these. And you have people who are going to try to capitalize on doing these. You want somebody with the experience, and you want somebody who's going to be safe. A lot of times people will go out of the country or far away to get these procedures, but there's very little follow-up with the surgeon in terms of complications, or if you want any touch-ups or revisions. Board certification in plastic surgery becomes very important, because there are a lot of people who are trying to capitalize on doing these who may not have the experience. And really, the rigorous nature of board certification in plastic surgery is it's a long and lengthy process. So not only do I have to go to an accredited residency, but I have to demonstrate safety in plastic surgery. And I have to take a written exam that attests to that. And then I have to go to take an oral exam where I have examiners look at all my cases and kind of scrutinize them to make sure, number one, I have good outcomes, and number two, I'm safe, whether it's a reconstructive procedure, a cosmetic procedure. And that takes a year and a half after I'm in practice to even get that. So it's a long and lengthy process. They really scrutinize it. The American Board of Plastic Surgery is a very, very on top of patient safety, because, like we said, there are people out there who try to capitalize on these things. And again, you want somebody who's going to be safe. You want somebody who has the experience and knowledge to do these, just like you all have the experience and knowledge to do these complex bariatric cases and complex revisions. So I think board certification in plastic surgery, but really board certification in everything is important, because it really attests to that physician's safety, their knowledge, their training, their ability to get you from point A to point B in the best possible way.
Yeah, and you're making me feel old a little bit because I'm coming up on my second recertification, where I'll have been board certified for 20 years soon. And it's a big commitment. You know, we have to do 150 hours of continuing education, take a test every 3 years, and maintain those ongoing educational requirements. So we've devoted ourselves to these arts and sciences that we continue to practice. So you want somebody who's actually devoted to this craft and not just getting on top of a trend, you know, to be part of a trend and, you know, keep your family and loved ones safe and not have to go south of the border and, you know, or to a distant land and you know, really potentially be in unsafe conditions to go for the surgery and not have follow-up. So better to stay local with people who are well-trained is the short answer.
That's exactly right.
So at this point, we can move on to some questions from the audience. So one question from the audience was, I had a lap band in 2013, which was subsequently removed in 2019. Would I be eligible to get an ESG? You would be eligible to get an ESG. So we would start with an endoscopy. We would take a look, get a lay of the land, take a look at the anatomy. But we're not really going to be touching the area where the band was. So I'm not worried about moving through scar tissue like I would if I was doing the procedure laparoscopically. We're actually going through fresh terrain when we're going in through the mouth. So I'm not concerned by previous surgery when I do this. It's a great option for patients who've had previous surgery because we're not actually disrupting any anatomy that hasn't already been disrupted. So it's fresh territory. It's very safe to do this procedure in somebody who's had that previous surgical experience. So another question, which we touched on briefly earlier in our chat, was what is the ideal candidate for the procedure? So very similar to an ideal candidate for any weight loss surgery. The current ASMBS criteria recommends bariatric surgery, including ESG, for patients whose BMI is over 35, even without a comorbidity. So the insurance classifications are really designed to help make a profit for the insurance companies. They're going back to the NIH criteria from 1991. So they're over 30 years old. They haven't kept up with the current science. So we do see benefit even down to 27, 28 BMI in Asian patients, South Asian patients, or Asian patients with type 2 diabetes, even to lower BMIs, like in the upper 20s with type 2 diabetes. But for any patient with BMI over 30 plus a comorbidity like type 2 diabetes or high blood pressure, you're a good candidate for this procedure. And the MERIT trial has shown that it does have benefit for these chronic diseases that are associated with obesity. And the weight loss expectations, as I addressed briefly earlier in our chat, were about 50% excess weight loss. So very close to what we would see from the laparoscopic procedure, but without some of the deficits of the laparoscopic procedure, including an incision, some muscle pain, abdominal pain. We really don't see that type of pain after this procedure like we do with conventional laparoscopic surgery.
Yeah, it's incredible. I just, to get that much weight loss without incisions is just awesome.
Yeah, it's really miraculous, and we learn more about these procedures, and the devices get better and better as time goes on. It's really amazing, the advances. From what I saw early in my career when we first started investigating, these were cumbersome devices that were nearly impossible to use, that took 10 minutes to place a single stitch. And then now we have the capability of putting, at least 50 stitches in the stomach in about 45 minutes. So it's, and a lot of that comes from my experience, ongoing and extensive experience with endoscopic procedures, endoscopic interventions, like the transoral revision of the gastric bypass, which I've done well over 500 cases for many years, and plus over the 3,000 cases that I've done going back to the early 2000s of conventional laparoscopic surgery. So we're well suited and well prepared to offer you these interventions, anything from medical weight loss to advanced revision procedures.
Dr. Sekhar, can you speak a little bit on the cost for an ESG procedure, if it's covered by insurance?
Yes,
Or not?
so the cost, unfortunately, insurance does not cover it. They do lag behind the science. It took them over 15 years to cover the sleeve gastrectomy after it was introduced. And like any procedure, new procedure or relatively new procedure, they will call it experimental and come up with ways to deny the patient's coverage for the procedure. So I don't anticipate that it'll be covered by insurance anytime soon. But in the meantime, it's a safe procedure, it's a beneficial procedure. So we do offer it as a service to our patients outside of insurance. The cost is approximately $14,000 for the procedure. That includes the treatment, the actual procedure, and the anesthesia. So all of the costs involving the procedure are covered by that fee.
And I know you touched on this at the beginning of this, but could you maybe just go over really quickly the weight loss expectations from the ESG for those that joined us a little later?
Yes, so the weight loss expectations, the MERIT trial, and in our experience has shown that a patient can expect, the average patient can expect about 50% of their excess weight to be lost after the procedure. So an example is a 5-foot-tall woman whose ideal weight by the insurance table should be 100 pounds, is at 200 pounds, she would lose 50 pounds with this procedure. So she would go from 200 to 150 with the endoscopic sleeve gastroplasty. So that's the average patient. Patients can lose more than that, patients can lose less than that. What we always urge patients to do is use this as a tool. And I also urge patients not to focus on a weight loss number as a goal. I want my patients to use it as a tool in combination with an eating regimen and an exercise program of strength building, cardiovascular training. So we want you to increase your muscle mass and get leaner.
Great. We actually had a comment that said, you two were two of my favorite doctors. But Dr.
Nice
Sekhar, Dr. Shafqat.
I have a lot of favorite patients, so I wish I could figure out who that was that left that comment.
But we do want to thank you so much for your time, your insight, and your expertise. And for our guests that are joining us tonight, if you are considering your options, contact us at stopobesityforlife.com and at nybgplasticsurgery.com.
Thank you for the opportunity to discuss these new and exciting topics with all of you. And I look forward to meeting as many of you as I can in person in one of our offices or by telemedicine.
Yeah, thank you all for joining. Thank you, Dr. Sekhar, for taking your time. Thank you to the marketing team for setting this all up. And we look forward to meeting all of you.
Thank you. Have a great night.
Have a good night. Bye.
Bye.